The top 5 peptides for muscle growth. Are you going to the gym on a daily basis and you're getting nowhere? Have you tried working out, eating well, and all of those potential lifestyle factors that should have you add muscle tissue? Sometimes our body could potentially be telling us something if you're not seeing results. Over time, our bodies lose the ability to recruit and have new peptides. So maybe, just maybe, peptides may be for you. Now, if you want that extra boost to add muscle tissue, burn fat, recover better, sleep better, I might have the solution for you. Now, as you're losing peptides, you don't have to completely just throw in the towel. There are synthetic versions of peptides, and that's what this video is all about. I'm excited to share with you my top 5 peptides, so let's get started. Now, peptides naturally occur in the body, and as you get older, much like other things, peptides start to decline. So if you're losing muscle tissue and you're getting older, it's possible that you may want to consider taking peptides. Now, lucky for you, science has the answer, right? Synthetic versions of peptides, and I promise you these things are safe, so go ahead and see my other video about peptides. If you want to know the difference between them and steroids. They're not a steroid, by the way. So taking these, we won't have to deal with loss of muscle tissue or any age-related factors from the declining rate of peptides. But can peptide therapy really help? Well, as somebody who takes peptides myself, I tell you they can help, and I promise you I have the answers for you in this video. Now, whether you're looking for the immune boosting properties, fat loss properties, gut healing things, peptides can really be for you, but there are some side effects that can be associated with them, and of course the dosage as well can be a direct correlation with the amount of side effects that you get. In this video, I'll share with you my top 5 peptides for muscle growth and how to exactly take them. Now, these peptides have their own mechanism to help you get ripped, and as always, consult with your doctor before doing this. This is an educational video, so make sure you check with your doctor, get all the blood work and everything before taking these peptides, all right? Now, let's have a little background about my top 5 peptides and let's get after it, huh? GHRP, number 1, growth hormone releasing peptide. This is pretty much the most famous one in the bodybuilding industry. This is one of the best for increasing growth hormone levels and helping add muscle tissue. Now, in the bodybuilding world, GHRP6 is known to be one of the best because it also stimulates appetite and helps add muscle tissue. And adding muscle tissue, you need to be hypercaloric and get more calories. So having GHRP will help you be hungry, add more muscle tissue, and just have a lot more energy. Now, bodybuilders have a hard time sometimes reaching their calorie needs. They have several thousand calories per day and they need to be hungry to eat that. So GHRP releases ghrelin, which tells your body, hey, I'm hungry, let me eat more, feed me. So basically within about 20 to 30 minutes of taking GHRP, you're going to be ravenous hungry and you're going to take down hopefully that relatively healthy meal. Now, what is the dosage for GHRP? Now, usually the dosage is 1 microgram per kilogram of body weight per day, and usually injected before breakfast or at bedtime on an empty stomach. Now, injections should not exceed 300 micrograms per injection. What are the effects of GHRP? Well, you have increased appetite, overall energy levels, and allowing you to train a lot harder and for longer. Significant muscle mass and strength gain, increased lean body mass, improved quality of sleep, not necessarily quantity, and you will have shorter recovery time so you can get after the next workout. The second peptide is IPAMORELIN. This is something I've taken myself. Now, IPAMORELIN is one of the newest and most talked about peptides on the market right now. In fact, some bodybuilders have decided that this is the better growth hormone releasing peptide even over GHRP. Now, this is because it mimics ghrelin and stimulates the secretion of growth hormone from the pituitary gland, and in turn you have more natural growth hormone in your body. Now, even more important, this does this without stimulating appetite. So if you're looking to be lean, if you're taking GHRP, it's going to stimulate that appetite, so you're trying to counteract those two things, trying to say, hey, I'm really hungry, but I really shouldn't eat as much. So IPAMORELIN could be the peptide for you. What is the dosage of IPAMORELIN? Now you want to start with about 100 micrograms in the morning. Often people take this at night before bed. That's when I actually take IPAMORELIN as well, because as you're sleeping, growth hormone naturally is releasing. So sometimes doctors recommend taking this at night. You can take it at night and of course in the morning if you want to, as recommended by your doctor. Now you can increase to 200 micrograms per day, and it's also been very beneficial to stack this with 100 micrograms of GRF mod 129. This is an 8-week cycle and you're gonna be feeling pretty good, and sometimes people take this up to about 12 weeks. What are the effects of IPAMORELIN? Well, taking this, you'll probably have decreased body fat, increased lean muscle tissue, improved recovery from workouts, anti-aging properties in skin, hair, and nails. Ooh, look at my pretty nails. And it'll also have minimal impacts on your cortisol or your stress levels. Number 3, the next one, HEXARELIN. Now this is another potent GHRP releasing peptide, HEXARELIN, or sometimes it's referred to as HEXAMORELIN. It's kind of a mouthful right there. Now this also enhances the release of growth hormone in your body. Now this increases cell regeneration and reproduction within our muscles, creating a more pronounced leaner muscle tissue and leaner muscle tone. On a side note, studies indicate that certain bone markers increase while using HEXARELIN, which suggests it helps increase bone density, potentially reducing risk of osteoporosis. So if this is one of the things that you're concerned about, this may be a peptide for you, and also reduces the indications of fractures. What's the dosage of HEXARELIN? Well, this is 100 micrograms injected at the same time each day. What are the effects of HEXARELIN? HEXARELIN will help with muscle tissue and strength gains, more pronounced muscle tone, overall increases in performance. You're gonna be able to run from zombies, no problem. Lower levels of body fat and a substantial increase in healing properties. This is one of the reasons that people really like this. There's another peptide called BPC 157 that they say heal like Wolverine. HEXARELIN can also help heal that muscle tissue or any sort of breakdown that you have. Number 4 is FOLLISTATIN. Over the past several years, FOLLISTATIN has been increasingly popular among bodybuilders. The reasons for this are very simple. Studies have shown that it promotes growth throughout the body and increases muscle tissue in response to damage. You're working out, you create muscle tissue damage and creates more of a response to that particular damage or that stimulus. It also helps increase muscle tissue because it's shown to accelerate the muscle growth by acting as a myostatin inhibitor. Now, why is that important? Now, myostatin limits how fast and how much muscle tissue you can put on. So by limiting myostatin, you can put on more muscle tissue. By doing this, FOLLISTATIN decreases myostatin, will increase the levels that you can add muscle tissue if you weren't taking something like this. And what is the FOLLISTATIN dosage? 100 micrograms injected once a day for anywhere from 10 to 30 days. What are the effects of FOLLISTATIN? Now you'll have a substantial increase in muscle growth in a short amount of time, decreased accumulation of body fat, effectively decreasing the size of adipocytes or the cells that store fat, rapidly increasing muscle mass, helps reduce muscle loss, and it also improves fertility. Now number 5, the last one is CJC 1295. This is something I've taken on my own, and I also take this in a combination with IPAMORELIN. So it's an IPAMORELIN CJC 1295 all in one little vial. Now CJC 1295 works by increasing plasma growth hormone levels in your body and has been a favorite of many bodybuilders and myself for years. It works similarly to the other peptides that discussed above, and it gives you greater muscle definition, a leaner frame, and more energy. Dosage for CJC 1295. Now there's 2 forms available, CJC 1295 DAC or drug affinity complex. That's a modified version with a longer half-life. I'm not a huge fan of that one, but if you don't want to be taking CJC every day or 5 days a week, depending on what your doctor recommends, a longer half-life, the CJC DAC will stay in your system and effective longer. So due to its long half-life with the DAC, drug affinity complex, it only needs to be injected once a week. Recommended dosages start around 500 micrograms per injection for a maximum of anywhere from 4 to 6 months. Now, in some cases, some people may benefit from dosages all the way up to 1,000 micrograms per week. week. But as lots of things are concerned, even with supplements or anything else, you want to start with a lower dosage and effect to see the effect that it has on your body. Now, if you're taking CJC 1295 without the DAC, the drug affinity complex, you can do anywhere from 100 to 500 micrograms per day. That could be injected several times per day. Okay, so 500 could be split into 3 times. I also take mine just at night. I take a very, very low dose, and every now and then I'll take mine in the morning, but it should be taking on an empty stomach. Now, what are the effects of CJC 1295? Shorten muscle recovery between workouts, improve muscle definition, increase muscle mass and muscle strength, and increased fat metabolism, reduce body fat levels, reduce signs of aging. Yeah, I think it's working for me, and improved quality of sleep. Now, how do you inject peptides? I have you covered. So if you're injecting peptides, you may be surprised how easy it actually is. It's a tiny insulin needle, very, very tiny, that diabetics take, and you really don't even feel it. Now, this is a subcutaneous injection, means it's just slightly going beneath the surface of the skin. It can be taken in a number of areas. It could be the upper arm and the abdomen, about 2 inches away from the belly button. I'm touching my abdomen, but you can't actually see it. You can do it in the lower back if you want, kind of right in the glute area, which is one of the easiest places to take it. That's where I take mine. Or you could pick some other areas if you want to, but upper arm, belly, and glutes, that's probably the easiest way to take it. So after you've chosen your site for injection, here's the step-by-step instructions. Number 1, have clean hands. So wash your hands or use sanitizer or alcohol if you have some. Now prepare the needle and the injection according to the instructions that you have from your doctor. Now you also want to use an alcohol swab on your injection site, and also take another swab and clean off the top of the vial that you're going to excrete the peptides into the syringe. Now you want to grab 1 to 2 inches of skin with your thumb and index finger, inject the needle all the way, and you can also aspirate the needle by pulling it out, making sure you're not hitting a vein or anything. And then from there, as long as there's no blood or anything, you want to simply just push the needle in there and inject the peptide. Now you want to remove the needle, dispose of it properly in a syringe container, one of those biohazard containers. Okay, don't leave them laying around. If there's any blood or anything, which I've never actually had any blood come from the skin, use a cotton swab and use a Band-Aid if you need, but most of these things are fine. You can just use another alcohol swab on top of it and you're good to go. Now that you know the top 5 peptides for muscle growth, it's time to talk to your doctor, get blood tests. Please don't just order from any website and just do this on your own. It's the wild, wild west out there with peptides and all sorts of different supplements. So please, please, please see your doctor. Hopefully you got all of the information that you needed. Comment below, do all the things on YouTube. I'm Joey Thurman at Joey Thurman Fit on all socials, at Joey Thurman Fitness on YouTube. That's where you're at right now. I will see you very soon. Cheers and be well.